with the third and final webinar of the Disability Reporting series. All right, let me get us started today. So I want to welcome everyone officially to our third and final webinar of the Disability Reporting series organized by Internews Health Journalism Network and the Internews Knowledge Center. Thank you for making time to join us today. We're really happy to have you here. We appreciate your interest in this important topic. As I said to you, my name is Bea Spadaccini and I manage the Health Journalism Network. I have the pleasure to nurture this network, which is a global community of over 700 journalists and media practitioners from over 60 countries. Please note that this webinar has live captioning to facilitate access for persons who are deaf. And please note that the live captioning is going to be put periodically in the chat box. So just a few words about the Health Journalism Network. We have three main objectives. The first one is to build community, to support the creation of a global and dynamic community of health media professionals that includes journalists, health communicators, investigative reporters, media entrepreneurs, and digital health innovators. Our second objective is to build capacity, to offer our members resources for improved health reporting that have been produced by our health media mentors and Internews partners. These include online courses like the Let's Talk Vaccine and Let's Talk COVID-19 online free courses for journalists, guidebooks, glossaries, tip sheets, thematic podcasts, as well as live webinars on key topics like this one. Our content can be repurposed for free to meet the health information needs of your local audiences. And please check out our website for the latest opportunities that we have posted under opportunities and stories. Our third objective is to really improve the quality of health reporting worldwide. As you know, health and science reporting is a specialized branch of journalism that requires ongoing learning. In many parts of the world, health reporting is not yet a specialized type of reporting. So we want to nurture the creation of health journalism networks in countries and regions where there are none. Through our members and their work, we seek to train the next generation of health journalists and media professionals. And right now, without further ado, I would like to give the word to my colleague Pat to facilitate today's webinar and introduce our panelists. Thank you so much.
Thank you, Bea. Welcome everyone, and thank you for attending our third and final webinar on reporting on disability. Today we are focusing on national and international frameworks on the rights of persons with disabilities and the role of the press in educating the public about these frameworks and their implementation. The rights of persons with disabilities are set out in the UN Convention on the Rights of Persons with Disabilities, which unfortunately the US has not ratified, despite being urged by disability rights groups. Kenya and Rwanda, where our speakers are from today, have ratified this convention. At any rate, it is important for journalists to understand these frameworks as well as the laws in their own countries in order to accurately report on stories involving disability legal issues. Today we're going to have three speakers. First, Paul Mugabe from Kenya is a public policy scholar and diversity and inclusion expert who is blind. He has more than 16 years of experience in the development and humanitarian spheres as an inclusive communication expert, a digital accessibility tester, and an accessibility evangelist. Paul is the only blind cricket player in East Africa. He is also a musician and a radio presenter at CMS Radio in Australia in Swahili. Paul was recently appointed the Global 3 ICT country representative of Kenya. Paul's vision is that we can reduce ableism by having an inclusive, accessible society for all. And more information about Paul can be found at mugambepaul.com, and maybe we can put that link in the chat. After Paul, we'll have speaking Musafiri Innocent. He's the program manager for the Rwanda Organization of Journalists Advocating for Persons with Disabilities, also known as ROJAPED. He produces Solidarity magazine, which is geared towards decision makers. And during the COVID pandemic, ROJAPED produced information on the challenges disabled people have with COVID, as well as making sure that people with disabilities were able to access information about the pandemic. And Rwanda just announced today that they have adopted a new policy on persons with disabilities for their full inclusion, participation, and to ensure that they live a dignified and secure life. That's great news. And then finally, we'll have Jackie Lee Dewey. She will speak, and Jackie is our awesome Internews project manager for the Inclusive Media Project in Sub-Saharan Africa, and she's also a multi-award-winning Kenyan television producer. And so now I will turn it over to Paul.
Okay, thank you everybody for giving me this floor. So I would like just share you about disability reporting in Rwanda, legal framework, experience, challenge, and opportunities. Next slide. So, general status of disability in Rwanda. So I choose just to present the prevalence of disability. It's approximately 5% of the total population, which was about 10 million in 2012. Most of persons with disability are physical disability, but we have also blind persons and those who have low vision and any others kind of disability are 30% of the total number of disability persons in Rwanda. Next slide. Before talking about the legal framework, I choose just to present the general landscape of disability reporting in Rwanda. So, according to the Rwanda Media Commission, we have radio stations, 32 radio stations in Rwanda, 12 television stations, and 48 print newspapers. As you can see in the figure third, I show broadly the accessibility rate in Rwanda. Accessibility, when I say how person with disability can access to media, so those are the rates we have. We did not yet made a research on this, but we consider our experience and intuitively we have this next slide. So what ROJAPED is doing in disability reporting. The first thing to do is advocacy by participating in disability forums. So we try to engage our advocacy. We try to influence policies, laws, etc. That is where within the civil society, but also when we have to make dialogue with governmental institutions. Do also reporting. We have a solidarity, a magazine that is produced from the ROJAPED, from our journalists, and we distribute through different institutions in Rwanda, just as a way to influence policy making friendly that are friendly to disabilities. So we produce some radio program and TV program, especially focusing on disability and events and various events we had during the year. We have also social medias and documentary films we try to engage. So we have also capacity building. We do capacity building by training journalists, trying to make them aware and skilled about disability issues in Rwanda. Next slide. This photo, on this photo, we have a journalist who is back to the previous slides, just to explain the photo. Okay, if that doesn't come, let's continue. So ROJAPED also, yeah, this photo, you see a girl who is a person with albinism. He is receiving certificate from a member of parliament who is elected by other person with disability to represent them in the. So now, after a training we had in 2018, we have this lady getting certificate from member of parliament. Next slide. Please, Christopher. Okay. Disability. Some project. We have a TV program. We have. Okay. Let's continue. We have some projects like a TV program and radio program. We have an understanding with Rwanda Broadcasting Agency to produce this program. So we need some means to implement it. So we plan to continue training journalists. We also want to promote talent of young persons with disabilities in journalism professionals, because we consider that they are the one who can advocate more than other. We plan also make monitoring of disability in Rwanda. Next slide. Okay, now let's talk about the legal framework of disability in Rwanda. The first thing we have to look on is the constitution. The constitution has some articles that talk about disability, how to promote disability. It is based on our history, because the Rwandan used to be experience discrimination, stigma. So based on history, they say, the government said, we have to avoid any discrimination, whatever it can be. So that is why disability are considered during. So we have also different provisions that provide address the disability within the constitution, as we are looking. Article 5, etc. So we can just understand that the constitution of Rwanda is disability friendly. Next slide. So talking just about the disability, the legal framework, we have to consider that now disability are represented at a very low local level up to the national level. So the international legal framework also integrated in Rwanda. One have different instruments of international legal framework. So as you see, is a list of different instruments that Rwanda ratified, and this can provide matter advocate for us and for anyone who are interested in disability question. So we have also different laws and policies that are trying to handle different aspects of disability in Rwanda. First of all, last week, government approved a policy, a disability policy. Yet it was in general understanding in Rwanda that we have to promote disability, but there was no yet a policy. Now, since last week we have this policy, but also we have national social security policy that integrates also disability. We have vision 2050. We have also the national strategy of transformation. That is an economic, national economic instrument where the well-being and the right of disability are priorities. We have also law that implements these policies. So we have a list of different law, but for example, we have a law that protects former combatants who are disability. We have also another right, that protects right of child with specific disability. We have also different ministerial orders that implement these policies, these laws. Next slide. So as we are looking, there is an impact. There have been an impact from this legal reform in Rwanda. Let me say that this reform have now last for 10 years. Since 10 years, there is different actions that are promoting disability from the legal reform in Rwanda. It also continues because there are some different area to improve. So, in general, these laws are promoting inclusiveness, promoting in various sectors: education, in healthcare, public transport, public building, water and sanitation, social protection, etc. We have also some laws that promote access to information for everyone, but also where disability are included. Because for us who are advocating for more inclusive communication, we can use this law to advocate for the promotion of access to information for persons with disabilities. This law also are focusing and have a component of banishing discrimination, because now from the law we have banished some languages or consideration that were discriminating and stigmatizing persons with disability. So from this law also we have better representation of disability, because where disability can elect their representatives from the village level up to the national level. Because now we have the National Disability Council that is made by all of national disabilities, and from different administrative instance of the village application level we have presented. So as conclusion, I say the result of this legal reforms, this effort of reforming to handle disability issue in Rwanda have produced results. Now, let me show that this photo. This lady, this girl, is called Miss Jocelyn Gishimana. She has completed a bachelor degree in journalism, despite she has physical disability. Yeah. So this is from the implementation of the inclusive education policy. So in general, the legal reform in Rwanda have provided a lot of advantage to disabilities. We cannot talk them here, but when you look at different laws and practice from different institutions, there is improvement, there is an advance. Thank you so much for attending to me.
Thank you so much, Musafiri. That was really great information about Rwanda. Paul, are you ready to present?
Oh, thank you very much for this forum. I appreciate Musafiri, who has just finished doing his presentation. And to begin with, I would like to say that I normally tell people that inclusion is a journey. So Musafiri, it's a good that you've started the journey. And it's a journey whereby it has no completion. It is like a race. And to begin with, discussing the issue about international policies and how they impact issues of disability and media presentation of persons' abilities. I would like to say that international policies are been coming up in terms of the inclusion of persons' abilities in different treaties, like the UNCRPD, which has been ratified and signed by over 184 countries. And I believe that through that, we are able to know where we drive the issues of persons' abilities. And, oh, sorry, I forgot to introduce myself. I'm a blind person, and I'm wearing a blue beanie and a red t-shirt. And I pay respect to past, present, and future journalists who have been of great help in this society. Sorry for that, I had forgotten. Let me now continue in terms of the next slide, in terms of why we need the disability mainstreaming in terms of media. It is because we know that 15% of the population are persons with disabilities, and they are the largest minority group. And as you know, they face 4 major barriers. 3 of them are attitudinal, where we know it's about perception, beliefs, discrimination, etc. The second one is environmental barrier, which talks about accessibility in terms of built environment, transport, infrastructure, etc. The third one is communication, where we talk about lack of alternative formats or communication issues. Then we have the fourth one, which is institutional barrier, where we talk about issues regarding policies, which we are talking about today, issues about resources, issues about data, such things. And the second reason why we are talking about this largest minority group is because these are the people who are not represented or lack knowledge in terms of policies, skills in terms of how public policies are being implemented. They are not having this information. So it becomes a major challenge. Thank you. When you look on this, okay, the next slide is all about examples of best practices of how policies have been implemented in different countries. And I wanted to give a good example of how United Kingdom has tried to make the voice for persons with abilities be heard through some policy implementation. I got lucky in 2016. I participated in a campaign whereby we were advocating for road safety shared space, and we did a video called My Lane. You'll look at it in once you finish this slide, you can click on it later on. And it really helped them to advocate for policies of transport, and the media was involved. Almost 6 media houses were participating in this campaign, and they are still going on, and they are utilizing this song, which I composed by myself and also collaborated with the other blind fellows from United Kingdom. So some of the examples, best practices are like policies which have been developed by other countries, are like the British Broadcasting Corporation, Australia Broadcasting Corporation. They have a disability policy, and even some international organizations have adopted some communication policies within the organization, which spelled out different issues in terms of how persons' abilities can be treated or how they can be able to access the media houses. This one is very important because I as a blind person, I can remember very well when we were trying early 2000, when we were trying to push for such initiatives. It was very difficult, and I know that we were being chased by the mere security persons at the gate of even reaching a major media house. And I remember a small incident whereby I wanted to take my own music to be played in one of the media houses, and the media presenter chased us away because he didn't think that blind fellas can sing maybe secular songs. They wanted us to be singing the gospel songs. Those are just attitudinal barriers which we face in this journey of inclusion. Another highlight of this example is that some of the policies which are being developed by organizations, they have been driven from the international best practices by United Nations, which has come up with a structure like a strategy plan, and many of them have adopted some disability action plans, which help them to improve their own policies here and there. And you may be able to see some of the, I'm using to see because I believe that one can be able to click in the internet and Google here and there. And for those who are blind, they can also try and check them out, such that in you may take examples of UNICEF, some other international organizations. They have tried to, as much as possible, to include these policies to make them to see a roadmap for themselves in terms of policies. Lastly, I would like to emphasize some of the articles in the convention which highlight issues of media, especially Article 8, which is all about awareness raising. Article 9 is all about accessibility. And also Article 30, which talks about participation in art and culture. This is where we find about issues about language, the deaf culture, issues around sign language, what people need to do in terms of that. And you have seen a lot of, for example, in Kenya, there is a rise of usage of sign language. It has not been an easy journey, and it is one of the best practices maybe we can highlight here, that Kenya Broadcasting Corporation was the first one to start the sign language policy. Although it is not, I was doing my research, it is not written somewhere. Maybe they applied what we call the unwritten law in terms of like the British rules whereby they have unwritten policies, but they still practice. So KBC started the journey, and currently we have a draft bill in Kenya called the Kenyan Sign Language. And such of these policies, they help to lay a roadmap for others to implement. And that's why you are seeing a lot of implementation of sign language issues, even if the policies were not there. So it seems that it's possible to implement issues of disability if there is that goodwill. And as you may see, in the rise of COVID, there are some digital practices or policy implementations which have taken place even without the policies being there. So you really wonder, why are governments, especially in the global south, ignore implementing issues of persons with disabilities? And for media houses, I believe there is a lot of opportunity whereby they can be able to really improve on media awareness and also emphasis on persons with disabilities participation. And being myself as an example of those people who have gone ahead and even interacted with some of the international media houses, there is one which I normally do. I'm a radio presenter in it's called Canberra Multicultural Station, CMS Radio, where I do some Swahili program to lay issues about East Africa news and music generally. And it's a interesting journey. So I believe that through such experiences, we are able to learn and gain more interest. And to finish up, there are some photos within my presentation where I've shown the people playing basketball inclusively, some children playing there. And I believe that it's a way to finish up my presentation by saying that persons with disabilities, they belong to the community. We are not from another planet. So as we implement the policies, I didn't want to go in the jargon language of persons with disabilities, which we normally use, but I just tried to make it very simple, clear, and ensure that as we implement issues of persons with disabilities, let us strive to be keeping it simple so that all those stakeholders can be able to understand in a more simpler way. And this is just a tip of the iceberg. And since this one is a question about the health uh, reporters, I would like you to continue to dig much deep so that when you attend such reporting in the media houses or when you visit, let's say, hospitals, try as much as possible to dig deep to understand the barriers which persons with disabilities face so that when you are reporting, you are able to understand that sometimes even the health providers, they don't have even accessible product which they use. For example, with my experience, I know there are blood pressure equipments which can speak to you and they can tell you, or even going ahead in terms of ensuring accessibility for maybe the beds or even some machines, so that when you get the information as maybe a blind person, you are able also to know the result just like any other person. I remember when HIV/AIDS was being introduced as a national issue in Kenya, uh, and being a risk taker, I went to one of the testing places because back then in the Kenyatta University, we were doing the testing, introducing that idea of testing for persons with and without disability. So I went there, and the questions which were being asked by the counselor were not supposed to be asked. But since you see the results by then, you are not able to read for yourself. You have to ask a friend or you go with a friend. So it happened that I went inside with a friend of mine, and this counselor was being shocked that I came with a friend and he started to ask funny questions to the person who is guiding me instead of asking me who was coming for the test. So sometimes even health service providers or even you as a reporter, once you engage persons with disabilities, try and understand the barriers so that we can be able to reduce and be able to understand more person's abilities. And once you are able to understand us, it will be very easy. And maybe I'll end there. Maybe we'll respond to questions later on. And I'm also ending by saying that let's strive to make an inclusive society for all of us by breaking the barriers of inclusion so that we can facilitate persons' abilities. And when you get to join us, it will be a comfortable zone for everyone so that all of us can be able to enjoy this journey and be able to network all of us. I really appreciate. Thank you very much. I hope that I've exhausted my 15 minutes. Thank you.
Thank you so much, Paul. That great information and advice. And now we have Jackie, who will wrap up the speaking.
Thank you so much, Pat, for the introduction. Also, I want to thank Paul for the great presentation and Musafiri. Truly, and also everyone who stayed online up to this with all the challenges we had in the beginning. It shows how inclusive you are and how you are really caring about matters of disability. Remember in our first webinars and the second one, we said when we are talking about disability, we have to be really patient because like Paul to connect, he's a blind person. He has to use all this technology alone. He doesn't have a guide. So just staying in there and even having a chance to stay and listen to us, we are grateful. So today I'm going to talk about inclusive newsrooms, and it is just a summary of what Musafiri and Paul have talked about really. So first of all, when we talk about inclusive newsroom or inclusive media, we are saying that we should have a responsive media which is responsive to the rights and needs of persons with disabilities by having inclusive programming, inclusive policies, and also having accessibility. So, and when we are talking about inclusive media, there is barriers. So the barriers in inclusive newsrooms include attitude, just what Paul has talked about. We have a negative perception and attitudes about persons with disabilities, so that's a barrier. And also communication. We find out media personnel don't understand disability culture and even disability language and terminology, so that's a barrier. Another barrier is accessibility. And when we talk about accessibility, we don't just talk about ramps for the wheelchair users. We are talking about accessible content. So that is a barrier which is still there. And also, finally, we are talking about policies. Policies in terms of policies of persons with disability in the media. You are not saying that when you are talking about stories of disabilities, not that you are helping those persons with disabilities, the rights of persons with disabilities. So we should have policies of disability reporting in our media houses. So some of the myths we have come across while implementing this inclusive media project in Africa, and I know it's worldwide, is the first one. People believe that people with disabilities are not many in this world. So it is an issue. So we don't really need to cover stories of disability because it is an issue. And also some media houses believe that disability programming does not really bring in enough capital. So we don't really need to have disability stories because we can't get money out of it. And also there's accessibility. They believe that accessibility is just in terms of ramps and buildings and maybe providing a guide to someone who cannot be able to see. And also we have a myth that disability is a health issue, and I would want to demystify that myth. Disability is not a health issue. Disability is a human rights issue. And so when they believe that disability is a health issue, that's why we see so many stories with disability angles, PT angles in our media houses. They also believe that persons with disabilities are very sensitive and they are very hard to deal with. And I would just want to allude to what Paul has said. If you don't network with persons with disability, you don't approach them, you just think they are very difficult people and sensitive, so they're just special, they just need to stay there. So those are some of the myths we need to overcome. So, and after talking about myth, I would like also to cite some of the challenges even that the media houses encounter. And the challenges include lack of capacity, and facilitation to journalists so that they can be able to cover disability stories. There's also lack of locally produced disability manuals for journalists to use, but I'm happy to announce that through the inclusive media in Africa, we've been able to come up with a disability reporting manual, and I think the link will be shared here. So for journalists in sub-Saharan Africa, there's a manual for you, so you don't no longer have an excuse of saying we cannot be able to do disability stories because we don't have a guide. Also, there's lack of employment of journalists with disabilities in the newsroom. And when we are talking about disability matters, we are saying nothing about person with disability without person with disability. So that's why even in this webinar, we gave person with disability a priority to start the webinar, because why are we talking about them and you cannot be able to give them a chance to express themselves and tell us what they believe. So we also need to give persons with disabilities an opportunity to work in our newsroom so that we can have their side of their story. So having cited the challenges, I'll just go through a quick guide to the inclusion of people with disability in the newsroom. Next slide. How we can quickly, the first one is we need to identify people with disabilities and their organization. So the main reason of us identifying this, if we engage with people with disabilities and the organization, we can be able to get credible information. And when we have credible information about person with disabilities and what is going on, our stories will be credible and they'll be readily accepted in the disability community and even for our viewers, because we'll be having credible information. Next slide. We also need to evaluate the situations of persons with disability, and this is what journalists do. Journalists do research. So we need to research about persons with disabilities and be able to find out which areas do they need coverage, which areas do they need to be, which areas are really impactful to them, so that we can be able to cover their story and tell their stories in the way that they really appreciate, not the way we see it is good way to cover it. Next. Also, we need to develop guidelines for including persons with disabilities in our newsroom. We need to have action plans of having a human approach rights in reporting disability, and not a pity angle or a heroic angle. So if we have guidelines in our newsroom that every week or every month we'll have stories of disability and this is how we are going to report it, then it will help us to have more inclusive newsroom. Next. We also need to provide training and mentorship, because we realize that journalists don't really train in our training institution. We don't really offer disability reporting. So it is the work of our organizations to be able to empower journalists with some knowledge on disability reporting, so that they can be able to report disability in. Paul, you can switch off your microphone. I think it is disturbing me. You can mute your microphone. So we need also to raise awareness of the human rights of people with disability and their capabilities in the story programs that we cover. That we can only be able to do that if we train journalists. So we also need to have a desk for which has a focal point for persons with disabilities. We find out that in media houses, we have a gender desk, we have a sports desk, we have a business desk, but we don't have a disability desk. So if you really want to talk about disability, who do we approach? Who is this focal person who is a go-in between the person with disability and our media? So we really need to raise awareness on the rights of persons with disabilities and to prevent discrimination against them. And if we have a focal person in each and every media house or newsroom, this will be a very good way of including that. Next. We also need to ensure accessibility, and when I talk about accessibility, it's not just about the ramps and the aids. We are talking about having accessible environment and also having accessible content. In accessible content, provide captions and also provide sign language interpreters so that the people who are deaf can be able to follow your programming. Next. Also, we need to encourage and facilitate the participation of persons with disabilities so that we can have inclusive media. This is by inviting representatives of persons with disabilities in our media houses. Apart from that, we also need to involve them in our stories. I remember mentioning that when you have a political story, it's good to have a woman voice. You need to have a man voice. It is also good to have a voice of a person with disability. So when we do our stories, in each story we have a voice of different people, then it is easier for us to have the voice of person with disabilities across. We don't just need to have stories of person with disabilities when we are talking about disability, but when we are talking about day-to-day activities in our society. So when reporters are going out there, make sure you also get the voice of a person with disability about the political happenings in your country, about agriculture, about education, about everything. That will encourage and facilitate the participation of persons with disabilities in our media content. Next. So this one Paul had mentioned in Kenya. Kenya is a best scenario of accessible content. The Communication Authority of Kenya directed that all media houses should have sign language interpreters during the news broadcast, main national events, and it has really played a key role during the COVID-19 situation. So during the COVID-19, all the public service announcement, they have to have a sign language interpreter. So you see, we have policies, but if policies are not backed by actions, then it is hard for us to mainstream disability in our society. So like for a Kenyan situation, if you are a media house and you don't have sign language interpreter on your station during news, you just get a warning letter, and then maybe the next thing your media house will be closed. So if all countries and nations could adapt maybe the Kenyan scenario, then it will be accessible to the person with disability. But most people complain, oh, the sign language interpreter is just in a small box, but we also say it's a good thing because children ask, what is that person in a small box doing? Then we answer, we say, yeah, that one is talking to people who cannot be able to listen. Then that is even another way of raising awareness, because we know, oh, so there are people, different kind of people in our society. So this is the Kenyan situation, and it is a good example which many nations can be able to carry out so that we can mainstream disability in our community and society. Next. So in summary, these are the points I just want to insist on. We need to invest resources on disability coverage. We need to increase inclusive media content in our news packages and even in our programming. We need to employ journalists with disabilities. We need to make our newsrooms accessible and accommodative, in that when you even invite someone with disability in your media house, they are ramped so that they will feel comfortable to come in. So accessible newsrooms is a good thing. And finally, we need to improve the working relationship between the disability organizations and our media house. This one for us has come in key when we are implementing our project, because in the partner countries, we have now linked the journalists with the disability organization, and it has been successful. We are getting very successful and good feedback from Tanzania, from Liberia, from DRC and Cote d'Ivoire, because now the journalists are in touch with the DPOs, and the DPOs are in touch with the journalists so they can be able to cover stories, and it is really bringing out a very good feedback. Thank you so much for listening to me, and thank you so much even for staying all this long. I think we are going to get in touch with everyone who attended from the first webinar to this and do a follow-up survey, and I think we are also going to provide certificates at the end of this training. Thank you so much.
Thank you, Jackie. That was really valuable information. Let's see, I don't know if we want to go over a few minutes for questions. If people have questions, they can put them in the chat, or you can raise your hand or even unmute yourself. Okay, I see that Joseph Kuya has his hand up. Do you want to unmute and ask a question?
Hello, my name is Joseph. Can you hear me?
Yes, go ahead, please.
I wanted just to request if it is possible to get all this information on mail so that you can be able to go through them.
Yes, we'll be posting. I think you asked if we were going to, if we can get this information again after the webinar. We're going to be posting the video or recording of the webinar with captions on YouTube. It'll probably be up in a day or so. I think it's also on Facebook, and maybe, I'm not sure if it has the captions on Facebook, but you should be able to see it there again. Dennis, okay. You have a question?
Hello, I'm Dennis from Kenya, famously known as Kakajuma. So my concern is, or my question is, how do we come up with clear clarifications when reporting on journalism, specifically on the PWDs? Specifically, you can have an immediate interview. Let's say it takes a short period, then which means for PWDs to make it, it becomes difficult. For instance, recently I wanted to do the stories on inclusivity here in Kenya, specifically political, in terms of disabilities in politics, or being given a chance to participate in what we call democratic here in Kenya. Then it came to me, so I realized that it is very hard to rearrange and make an early planning. So my question is, there are some restrictions in media law and ethics that restrict you to cover stories to a certain capacity. So how are we going to work on that?
Jackie, do you want to answer that?
Thank you, Kakajuma. I don't really think I've really gotten your question, but maybe after this call, we can have a discussion and then we see the way forward.
Okay, thank you. Okay. I see Mira Lakarishanan. Sorry if I'm not pronouncing that correctly. Do you want to unmute and ask a question?
Yeah, hi, Jackie. My question is for you. Actually, in India, especially in Tamil Nadu, we never call people as a person with a disability. We used to call, as a government, also have a welfare board called differently abled. They don't want to. They want to honor people not with the person with the disability or disabled persons. They used to have a term differently abled people. But you mentioned in the last seminar that that should be mentioned as a person with a disability. So how we can understand that? And another thing, what we are practicing in India, especially in Tamil Nadu, we never use the word lame. For example, don't tell your lame excuses. You know, because when we are using the lame, if we are converting into our regional languages, it is more hurting words like things. So we never use that lame as a word. For usual conversation itself, we never use the word lame. And more or less, you said call them as a blind. Those who are having visual impairment, you said that call them as a blind. So if it is being, I am wearing spectacles from my childhood. I used to be teased when I was wearing spectacles for low vision. They used to have take me students and teachers used to tease me with the terms of wearing spectacles in the early ages. So they used to use the words not able to see properly, vision impairment. Nowadays we are using vision impairment, but olden days during 90s they never used the word vision impairment also. So as a person, it hurts me much when I see, when I hear about me, they used to know in the regional languages, that is very hurt to me. But when the government gave alternate words to address, but when you are internationally, when you are advocating this kind, use the term as a blind or a person with disability, then how can we do implement in our local reporting? That is the major question I want to ask.
Okay, thank you so much, and for that great question from India. So I'll start with Able Differently. I also mentioned I started a program called Able Differently. So Able Differently, it is a terminology which came in when now the disability movement was coming up, and we were thinking on which languages can we use maybe to sugarcoat disability. But now people with disability, and Paul will agree with me here, they say there's nothing like, if you are running away from disability, then you don't really recognize disability and you think disability is something bad. So that's why you want to sugarcoat it and call it Able Differently. So it is just disability. But because disability can be in plants and even animals, so because we are talking about human beings, so you start with a person, then their disability. So the internationally agreed language is person with disability, but it differs from several communities. In the West, they say disabled, it's okay. But in the global South, like India, like Africa, when we translate into our languages, it becomes something which is bad. So we prefer saying a person with disability. Don't say able differently, because that is ableism. If you don't have a disability and you call someone with that disability able differently, they think you are really sugarcoating. I also agree with your second question about lame. We don't say lame excuses, because that is still ableism. You think that lame is something bad, so you are telling someone, don't give me those lame excuses. So the derogatory language is being phased out, but what we recommend, we can be able to use the human rights approach. The human rights is the human first, and then their disability. About the visual impairment, also most people who are blind, they say they don't want to be called something impaired. Even the deaf, they don't want to say impaired. Impaired, it means something which has a problem and it needs repair. So instead of saying impairment, just say blind or low vision. So that is what I can advise you. And we also share resources on where you can be able to get international recommendation on the terms and terminologies that you can be able to use in your day-to-day reporting. Thank you so much from India. Moral Kish. Thank you.
Thank you, Jackie. That was really good. Yeah, I think the language is, always evolving, and in the U.S. context, a lot of people in the disability rights community are proud of their, the fact that they have a disability and they've been able to, work with those challenges, and so it's a source of their identity and pride. So that's why they might say I'm disabled or I'm blind, because they're not ashamed of it. That's just part of their identity. So that but it is definitely differs around the world, and I think Jackie, it's an important point that Jackie makes about the persons with disabilities are the person first language in many parts of the world. So I think we probably are at a time limit, and I want to just, if you do have additional questions, please feel free to put them on WhatsApp or email us, and we will try to get back to you with those responses. But I want to thank everyone so much for attending this. I think it's a really important issue, and I hope that we can maybe do some more in the future. And as Jackie mentioned earlier, we will be sending out a link to an evaluation form that we hope everyone will be able to fill out. And you can also please continue to check the Internews Health Journalism Network website for any additional webinars that are coming up. Thank you. And thank you to all our speakers. They were just really great.
Thank you so much. Bye, everyone.
Thank you and bye.
Bye. Thank you.